my name's Peter Kim. I'm currently in Boston. I grew up in Southern California, but in Orange County, and then I went to high school in Korea at an international school. From there, I went to Brown for both college and medical school, where there's an 8-year program. And I finished there after 8 years, and then moved to Chicago for residency at Northwestern in general surgery and plastic surgery. And then I did one additional year of hand and upper extremity surgery at the University of Washington in Seattle. And then since then, I've been here in Boston, where I'm on faculty at Beth Israel Deaconess Medical Center. I'm duly appointed through through plastic surgery and orthopedic surgery, subspecializing in hand surgery. And I'm also on faculty at Harvard Med School. And I've been in practice since 2011. There's actually only two jobs I ever wanted to do. One was to be a doctor, and the other one was to be a window washer. When I was a kid, I used to watch the guys high up on the ropes on the sides of skyscrapers, and I was mesmerized by how they were using the squeegee. Basically, from mid-elementary school onward, I always knew I was going to be a doctor. I always knew, I was curious about the human body. I had a keen interest in science. I liked the altruistic side of medicine. I always knew that that's how it was going to play out somehow. And every opportunity that I sought in high school and beyond was sort of pointing me in that direction, just to help me understand what it meant to be a doctor, and all the hoops, as you know, the many hoops that exist to jump through. I was very fortunate to get into this 8-year med school program where once I applied and I got in through high school, I didn't have to apply to medical school. So that gave me a little bit of leeway in college, where I didn't have to take the MCATs. I only had to take a few of the pre-med courses, and it really freed up my time in college and offloaded some of the pressure and the grind of the pre-med curriculum, and allowed me to explore a lot of liberal arts classes. I took a ton of classes in philosophy and religion and political science, and just things that I normally wouldn't be able to do. So by the time college finished, I felt ready to go to med school, and I felt ready for the grind. And truthfully, when I got to med school, I think a lot of people would relate to this. You feel like there's such a buildup to get to med school, because you take your classes, you take the test, and finally you're there, and you find like I've arrived at the place where I've been preparing for all these years. And I felt inherently sort of motivated and excited to just jump into the material feet first, and I kind of lapped up every day. And there were long days for sure, and there were seasons of stress and pressure. But man, I look back very fondly in my time in med school. This is a time of great camaraderie, and being surrounded by people who are like-minded, who are equally hardworking and motivated and bright. It was an awesome, invigorating, 4 years. So I feel very fortunate. Yeah, plastic surgery, it's a subspecialty of general surgery. It used to be the way to become a plastic surgeon, you used to have to finish 5 years of general surgery residency and then apply for a plastic surgery fellowship. But the training has changed, and there are many programs where you can now apply straight out of medical school and go straight through 6-7 years and get some general surgery training as well as plastic surgery training, and then come out in the end and you're board eligible for plastic surgery. What plastic surgery is as a specialty, plastics surgery, the name comes not from plastic as we think of like the synthetic material, as some people presume. It actually comes from the Greek word plastikos, which means to make and to mold. And a lot of what plastic surgeons do is to take parts of the body that are injured or disrupted by birth defects or cancer surgery, and then we train on how to put things back together. So I train in the entire spectrum of plastic surgery, adult, pediatric, reconstructive, cosmetic. And then from there, I grew an interest in hand surgery, which is kind of this weird intersection between both orthopedic surgery and plastic surgery. And I arrived at hand surgery just because I was intrigued by by the human hand, and what an amazing and beautiful machine it is. And one of the unique things about hand surgery is that we're able to work with every possible tissue type. So skin, bones, muscles, tendons, nerves, blood vessels, and we meet people from all walks of life. Whether you're a librarian or a construction worker or a professor or a CEO. Everybody uses their hands for different reasons, and so kind of a cool cross section of society where I get to meet folks from all walks of life. But that's my long-winded way of answering your question, which is what plastic surgery is. And I think the common layperson's perception of plastic surgery is that it's just cosmetic surgery and nose jobs and boob jobs. That is a very, very, very small subset of the types of procedures that we do in our specialty. But those are some of the things that are most visible and portrayed in the media. But we train in many, many aspects of surgery. One of the cool things about plastic surgery, unlike a lot of other subspecialties like ophthalmology or OBGYN or urology, is that we get to operate over the entire body, which is fun. Routine day, generally, like most surgeons' days are split up, where they spend some days in the clinic and then some days in the operating room. So I operate essentially 2.5 days a week, and then I spend 2 days a week seeing patients in the office. So on the surgery days, my day starts usually around 7, and then on clinic days, the clinic usually starts around 7:30. And then we also have academic conferences, and typically in surgery we do the conferences early in the morning before the day starts. So we have conference like today. We met at 6:15 in the morning. We had a teaching session for the residents and the fellows and the medical students, and then my normal day ends around 5-ish, give or take. I think there's some level of unpredictability, whenever you're in the operating room particularly. And then I take call. So sometimes we have emergency case that we have to do. In hand surgery, some of the emergencies that we have to deal with include bad infections, something called compartment syndrome, where if somebody has a crushed arm and there's too much pressure in the muscles, we have to release the compartments. The other things we deal with are that are potentially emergent are, if people sever fingers, we have to reattach fingers. Those are some of the common things that we deal with. So my quote unquote elective sort of predictable schedule is pretty much 6:30 to 7 a.m. till usually late afternoon, early evening, and then we share call duties in case there are emergent cases that we have to cover from the emergency room. I think I alluded to a couple things earlier. I think number one, I love the precision of the surgery that we do. The hand, like as I was saying earlier, it's like a fine-tuned machine, and the surgery involves some amazing anatomy, and so we're dancing around important structures. And I think one of the things that hand surgeons pride themselves in is the technical precision of how we do surgery. So that part is very gratifying to me. And then I would say the other gratifying part, as I was alluding to earlier, is the ability to meet people from all parts of society. I really enjoy meeting people that I wouldn't otherwise be able to meet. Whether it's people who are laborers or people from society who are just hardworking people, and they come in with an injury. I get to meet them for a season of life. We get them better, and they move on. There's a level of gratitude and a level of fulfillment that I get in helping people overcome whatever adversity they had, and then they move on and they can resume their productive lives as members of society. So I definitely get a ton of satisfaction out of that. One of the challenges, it's time. Particularly earlier in my career, you're just working long hours. During training, the hours are long. We have this saying that the days are long, but the years are short. So, the training years are arduous. Some of the unpredictability of our schedules sometimes is tough, especially if you have a family and there are demands outside of work. So yeah, it's physically demanding, or long days. There can be long days. I think personally for me, just in my situation, I would say the main challenges are related to time and time management. I think for me, it's pretty easy because I'm in an academic environment. I mean, I'm technically in private practice, but I'm very much aligned with a teaching program. So, I'm in multiple teaching conferences a week. I operate every day with fellows who are in training. So these are graduates of residency, either from orthopedic surgery or plastic surgery, who are spending an extra year with us to learn hand surgery. So the trainees are always asking questions, and they're bringing new ideas that they've learned in recent studying of articles. So working with trainees keeps me current. Going to conferences where we discuss current literature and current topics keeps me current. Attending and speaking at conferences and meetings outside of our institution also keeps me current. For someone who's is sort of aligned with an academic or a teaching program, staying current sort of happens naturally as the flow of work and as the flow of information happens when you're trying to train somebody. If you're in a private setting where you don't interface with a teaching program, I think it's a little more challenging day to day. It requires more upkeep with reading journal articles, and there are ways to get what's called continuing medical education through online resources, and of course, you can go to your national meetings to also stay current. For hand surgery, there's kind of two ways things are going. Number one is trying to find ways to do surgery that's less invasive, right? So every time you operate on the hand, there's downtime, and then that means time away from taking care of your family or time away from going to work. So there are ways to figure out, well, can we do the same surgery, but make the incision smaller or do it quicker or do it in a way that inflicts less swelling, less pain so that people can go back to work quicker. And then on the other extreme, one of the ideas that's really been seen a lot in the lay literature and the media is hand transplants. So these are people who have major injuries or missing limbs. Rather than giving them a prosthetic hand, there's a pretty well established precedent now, probably in the several dozens in the world, where people get transplanted hands from somebody who recently passed away, much like you would get a liver transplant or a kidney transplant or a lung or heart transplant. But the one of the major ethical dilemmas and questions is, unlike a liver transplant, which is truly a life-saving surgery, or a heart transplant, which it can be truly life-saving, a hand transplant doesn't necessarily save somebody's life, but it significantly improves their quality of life. In order to not reject the hand from another person, from the donor, you have to take lifelong immunosuppression medications. And those medications, though they would prevent your body from rejecting that transplanted hand, increase your risk of cancer. So you're improving, on the one hand, pun intended, the quality of somebody's life, but in order to maintain that quality, they have to be on medication that may perhaps jeopardize their quantity of life because they're at risk of getting cancer. I mean, one notable example of that is the first woman who had a face transplant in France just in the last year passed away, maybe 6 or 7 or 10 years after her transplant from cancer. That's kind of the other extreme version of what's kind of on the cutting edge of what we're doing on hand surgery. I think medicine, it isn't just a job. It's a lot of work. A lot of times you're not in control of your time because, you take an oath where you're going to be given the privilege of taking care of other people. And sometimes that privilege comes with tremendous responsibility. And I think there are going to be moments where the long hours and the burden can be onerous and sometimes overwhelming. I think doctors will not go hungry, but doctors, medicine is definitely not the easiest way of making a living. It's definitely, for me, the most gratifying way, and it's certainly been fulfilling in every facet possible. But if you see it as just a way of making a steady income and just doing it as a job, as opposed to, you know, a greater responsibility. You see it as a calling. I think it is easy for people to get burned out and get bitter and feel like, you know, what was all this for? And just kind of see it as a, you know, like, man, why am I doing this? But if you see a higher purpose to why, as to why you would want to do something like this and give up so much time and spend many of your young years working hard and training and not having weekends to yourself, if you see a higher purpose, however you define that, if you see a higher purpose to why you would need to do that, then I think that'll motivate you in the long run. And you know, I feel really really fortunate that you know I feel that sense of purpose. You know, I can't say that I couldn't give you a formula as to like how to intrinsically or innately get that. I think that's just a lot of soul searching, but I feel like it's been given to me, and you know, it's been such a fulfilling career. You know, I'm only 43 now, and I feel like I could keep doing this for a long time. And I'm super grateful, you know, for the chance to do the work that I do. And yeah, I definitely feel fulfilled in ways that I know that I wouldn't be fulfilled doing anything else. So I think if you can find that motivation somewhere, and be inspired somehow, then that'll carry you a long, long way.